Welcome to the deep dive. Today, we're tackling a topic you actually asked about, and it turns out it's, well, more complex than you might first think. Lipomas.
That's right.
You send over this really comprehensive guide, and our mission today is basically to pull out the most insightful and honestly surprising bits for you without getting totally bogged down in medical jargon. So, ever wondered about those, mysterious lumps? Let's dive in.
Absolutely. And what's interesting right away is that a lipoma at its core is just a non-cancerous growth of fatty tissue, what doctors call adipose tissue.
Adipose tissue.
Think of it like a little contained collection of fat cells. But like you said, that simple definition, it hides a surprising amount of variation, as your guide points out.
Okay, so adipose tissue, that's just the medical way of saying fat, basically.
Pretty much.
But the guide goes a bit deeper, mentioning these things called adipocytes and then white and brown fat. What's the key difference there we should know?
Right. So adipose tissue is mainly made up of these fat cells, adipocytes. White adipose tissue, or WAT, that's mostly for storing energy, the fat we usually think about.
Uh-huh.
Brown adipose tissue, BAT, has a different job. It generates heat. Thermoregulation.
Okay.
And your guide notes, both types come from what are called mesenchymal stem cells. These are like the body's master cells that can turn into various tissues, including fat. So a lipoma is just an overgrowth of one of these fat cell types, essentially.
Interesting. So it's a bit more nuanced than just like a random blob of fat.
Exactly.
The guide also mentions terms like lipomatous tumor and even lipoleomyoma. Are those just different ways of saying the same thing, or?
Pretty much, yeah. Lipomatous tumor is a bit broader, just means any benign growth of fat tissue. Lipoleomyoma is slightly more specific.
Oh, so?
It suggests that while fat's the main part, there might also be some smooth muscle tissue mixed in. The key thing is, even these simple-looking fatty growths can have slightly different makeups. The guide also says they often start as benign soft tissue tumors, or sometimes just when fat sort of pushes through the fascia, that connective tissue layer under the skin.
Gotcha. That gives us a good handle on the what. But then the guide kind of throws a wrench in things, saying even though they're usually harmless, in really rare cases they can transform. And they can also get infected or have, like, cell death inside. That does take the edge off the whole harmless lump image a bit.
It does, and it's an important point to make. While the vast majority of lipomas are benign, won't cause serious issues, the guide rightly highlights that very rare chance of one becoming a liposarcoma.
Which is cancer.
Which is a type of cancer, yes.
Yeah.
And that's exactly why getting a proper diagnosis is so crucial. The potential for infection, or what we call necrosis, cell death within or around the lipoma, that's also something to be aware of, though it's not common.
Okay.
So the underlying message from the guide seems to be, what looks like a simple lipoma might just occasionally be something else that needs medical attention.
Right. And this guide really hammers home that lipomas aren't all cut from the same cloth. It's got this surprisingly long list of different types. It's way beyond just one kind of lump of fat.
Exactly. The way we classify them often comes down to, well, where they are in the body and what other kinds of tissue might be mixed in with the fat cells.
Ah.
And this is where it gets really interesting because it shows how these fatty growths can pop up in very different ways and places.
Okay, let's look at some of these. Fibrolipoma, that sounds like fat mixed with something fibrous, right?
Precisely. A fibrolipoma is just a lipoma with a good amount of fibrous or connective tissue along with the fat.
Okay.
Then you have something really quite different, like a corpus callosum lipoma.
Right.
That occurs in the brain.
In the brain, wow.
Yeah, and it can even involve the nerve fibers there. Imagine a fatty growth actually tangled up with brain tissue.
Yeah.
Pretty remarkable.
Wow, okay. And then there are intramuscular lipomas, growing inside muscles. You wouldn't necessarily think fat would grow within muscle tissue.
You wouldn't know. And these intramuscular ones can sometimes be deeper, maybe cause more discomfort, depending on their size and exactly where they are.
Makes sense.
The guide also mentions lipoblastoma and lipoblastomatosis. These are often found in young kids and contain brown fat or sometimes this jelly-like stuff called mucin.
So they even vary based on the fat type and the person's age.
Seems so. It tells us lipomas aren't just one static thing.
And angiolipomas, the guide specifically says, these can be painful. What's different about them?
Angiolipomas have a key difference. Lots of blood vessels. That's the angio part.
Oh.
These little vascular nodules, they can be more sensitive and so, yeah, more prone to causing pain.
Okay. The guide also lists acral nodules on fingers and toes.
Yeah, fingers and toes. And then spindle cell and pleomorphic lipomas, They tend to show up on the back, neck, shoulders, often in men.
Oh, interesting.
And interestingly, there's also an intradermal spindle cell lipoma, which is apparently more common in women, and can appear on arms, legs, head, neck, trunk. A bit different again.
It's almost like they have preferred locations and demographics. Then there's benign symmetric lipomatosis or Madelung's disease. That sounds quite noticeable. Fat deposits in the head, neck, shoulders.
Yes, Madelung's disease is known for these more widespread symmetrical fat collections. It can give a very distinct appearance.
Huh.
And similarly, adiposis dolorosa, or Jerkin disease, involves multiple painful lipomas, often with fatigue. That suggests maybe a more systemic issues involved sometimes.
The list just keeps going. Pedunculated lipomas that have a stalk.
Like a little stem, yeah.
Hahami hyperplasia, where cells grow abnormally large. Even lipomas in really surprising spots like the internal auditory canal potentially pressing on cranial nerves.
Yeah, that could cause hearing or balance issues.
Or spinal lipomas, and then ones in the heart, intramyocardial, epicardial, atrial, intramyocardial. That is a huge variety of locations.
It really is.
So the key takeaway here isn't just that there are many types, but that the location, and sometimes the tissue mix, dramatically changes how a lipoma might act and if it causes problems.
Exactly right. It's not just a lump of fat. It's about
Right.
where that fat decides to grow and maybe what else it's growing with.
Yeah.
And the guide even touches on myelolipomas, which contain tissue that actually makes blood cells a very different function.
Wow.
And sciatica lipomas affecting the sciatic nerve.
This long list really drives home the point. A lipoma isn't one simple thing. It can vary a lot: where it is, what it's made of, what effects it has.
And importantly, to make sure we're not confusing things, the guide also lists conditions that can look like lipomas but aren't, like fibromas, neuromas, and crucially, the cancerous liposarcoma.
Absolutely crucial distinction. Telling lipomas apart from other benign things, and especially from malignant conditions like liposarcoma, is essential for the right diagnosis and management.
Right.
By including those lookalikes, the guide really underscores why you need professional medical evaluation, not just guessing based on feel. Definitely. Okay, so we know what they are, roughly, and that they come in a surprising number of varieties. But what actually causes these things? The guide says the cause is often unknown, which is, well, a bit frustrating.
It is often frustrating in medicine when we don't have a single clear cause. While we can't always pinpoint a specific trigger, the guide does lay out a range of theories being explored.
Like what?
Things like diet, genetics, whether it runs in families, injury to a specific
It's
area.
pretty real.
As one theory, perhaps trauma triggers abnormal fat cell growth in some cases. And then a whole range of diseases are mentioned: general health issues, chronic problems, metabolic disorders, even nutritional, parasitic, and infectious diseases are on the list of possibilities.
That's a really broad net. Electromagnetic energy and environmental factors even get a mention. It sounds like they're casting around quite a bit.
Exactly. They're considering a lot without necessarily settling on one main answer for all lipomas. The guide also throws in other potential factors like maybe blocked glands in the skin, hormonal shifts, general issues with metabolism. It's quite likely that lipomas develop due to a combination of factors rather than just one thing. The fact we don't have a definitive answer is why this area is still being researched.
Yeah, makes sense. Okay, so moving on. Say you feel a lump. What are some clues that it might be a lipoma just from how it looks and feels? The guide talks about visual identification.
Right, the physical exam part. The guide highlights a few key things you might notice. Lipomas are often described as feeling firm, but also kind of rubbery.
Firm but rubbery.
Yeah. It also notes that if a lipoma has more of that fibrous tissue we mentioned, it might feel a bit more solid, less squishy.
Okay.
A really key characteristic tends to be their mobility. If you can pinch the lump, a lipoma should usually move around pretty easily under the skin. It might even sort of slip away when you try to press on the edge.
Ah, the slippery sign. And shape.
Typically oval or round.
Ah.
Shape-wise, they tend to be fairly regular.
And size seems important too. The guide says usually 1 to 6 centimeters, but they can get much larger. What happens then? When they get big?
Yeah, when they grow significantly, the guide mentions up to 20 centimeters, which is quite large. They can start causing problems just because of their physical size and weight.
Like mechanically.
Exactly.
Yeah.
And they can also press on nearby nerves, which can lead to pain or maybe tingling, numbness, other nerve-related symptoms.
So even if they're often not painful themselves, their location and size can definitely cause trouble.
Precisely.
The guide then goes into interactions and side effects, which sounds like it's about more than just a visible bump.
It is. While pain is often absent, the guide points out, Like we just said, if a lipoma is near a nerve, or a nerve cluster, or even bone, the pressure it exerts can definitely cause discomfort or even significant pain. That nerve compression is key.
Right, it's the pressure, not the lipoma tissue itself being inherently painful.
Usually, yes.
What other kinds of compression risks are there? The guide mentions arteries and organs, which sounds serious.
Yes. The guide specifically flags the potential for lipomas to press on arteries. It even gives the example of coronary arteries around the heart. Obviously, that could have major consequences.
Yeah.
They can also compress the space around organs, like the pericardial space around the heart, or put pressure on various other tissues, nerves, muscles, tendons. In more severe, rarer cases, they might even compress entire organs, like the heart itself, or even bone.
That's quite concerning. So it's not just about pain, it could genuinely affect how your body functions. The guide also touches on functional impairment, affecting circulation.
Exactly. A lipoma can interfere with the normal movement and compression of skin and the tissues underneath it, potentially affecting local blood flow and fluid circulation.
Hmm.
The guide also notes that just pressing on a lipoma might lead to bruising in the underlying tissues, and in rarer situations it mentions complications like ulcers, bleeding, blockages, even embolism,
Embolism, like a piece breaking off.
where a piece of the lipoma or maybe a related blood clot breaks off and travels in the bloodstream. And there's even a mention of potential changes in the heart's electrical activity, like arrhythmias, if a lipoma affects the heart muscle or its surrounding space.
Lipomas in the heart. That sounds incredibly unusual. What kind of implications could that have?
It's definitely not common, but if fat grows within the heart muscle or on its surface, it could potentially interfere with how the heart contracts or how electrical signals pass through it, leading to rhythm problems or affecting pumping efficiency. It highlights just how varied these can be.
Wow. And it sounds like if you already have other health issues like autoimmune diseases or chronic pain conditions, lipomas might somehow make those worse.
That's what the guide seems to suggest, yes.
Yeah.
The exact link isn't really spelled out or understood, but it indicates that in people with conditions like autoimmune disease, chronic pain, or fibromyalgia, the presence of lipomas might contribute to or perhaps intensify their existing pain. And it's worth noting, the guide points out that common pain relief methods, anti-inflammatories, topical creams, usually aren't very effective for pain caused specifically by the lipoma's pressure,
Why is that?
likely because they don't address the root cause, which is the physical pressure from the fatty mass itself. They might help with associated inflammation, but not the mechanical compression.
Okay. So if you suspect you have one, seeing a doctor is clearly the way to go. How do doctors actually diagnose these? The guide lists a few medical ID techniques.
Right. Medical identification usually involves a combination of that physical exam we talked about, plus some form of imaging.
Okay.
One common technique mentioned is a fine needle aspirate biopsy. A very thin needle takes a small sample of cells to see what the mass is made of.
But there's a caution there.
Yes, the guide does caution that this might not be the best first step if there's a serious concern it could be cancerous, like liposarcoma. There's a very slight theoretical risk of potentially spreading malignant cells with the needle, though it's considered low.
Good to know. What about imaging like ultrasound? The guide says it shows composition and structure. What does a doctor look for on an ultrasound?
Yeah, ultrasound is great because it's non-invasive, uses sound waves. The guide notes a lipoma often appears as what's called a hyperechoic lesion,
Hyperechoic.
meaning it reflects more sound waves, appears brighter on the screen compared to the tissue around it.
Yeah.
That difference in echo is a key visual clue for doctors about its fatty composition and structure.
Got it. And then we get to the more advanced stuff, MRI and CT scans. What extra info did they give?
Magnetic resonance imaging, MRI, gives really detailed pictures. Much more info about the makeup, specifically density and the precise size and location. Crucially, MRI is often used to help rule out liposarcoma.
Because it's better at telling fat from cancer.
It's generally better at distinguishing between different soft tissue types, including normal fatty tissue and potentially cancerous growths, yes. Computed tomography, or CT scans, also give information on composition and structure and are also used to help exclude liposarcoma. The guide even mentions specific types, like multi-slice CT and axial CT.
Interestingly, the guide dives into this concept of radiopacity and the Hounsfield scale for CT scans. Can you break that down simply? Sounds a bit technical.
Sure. Radiopacity, or radiodensity, is just about how much something blocks X-rays. Denser stuff blocks more, looks lighter on a CT scan.
Right.
The Hounsfield scale, or HU, is just a standard way to measure that density on the scan. Water is 0, air is way down at -1,000, dense bone is way up, maybe +3,000.
Okay, so where do lipomas fit?
What's relevant here is the typical HU range for lipomas. The guide says it's usually between -120 to -50 HU for mostly fatty tissue. It might go up maybe +80 to +115 if there's more solid stuff mixed in.
So it gives doctors a number to quantify the fattiness.
Exactly. It's a quantitative measure of the tissue density. And the guide even points out that another type of growth, an adrenocortical adenoma, has lower HU values, less than +10. So this scale really helps doctors differentiate between different types of masses.
That's incredibly useful for diagnosis. And what about if a lipoma might be messing with nerves? The guide mentions nerve conduction tests and EMG.
Right. Those tests come into play specifically if there's a suspicion that a lipoma is pressing on or affecting nearby nerves.
How do they work?
Nerve conduction studies measure how fast electrical signals travel along a nerve. Electromyography, or EMG, looks at the electrical activity of the muscles those nerves control. Slowed signals or abnormal muscle activity can indicate nerve interference, potentially caused by the lipoma.
Okay, so we figured out it is a lipoma. What are the treatment options? The guide lays out quite a few approaches.
Yeah, the approach really depends on whether it's causing any problems. If it's asymptomatic, no pain, not limiting movement, not cosmetically bothersome to the person, the guide points out that often no treatment is needed at all.
Just watch and wait.
Exactly. Simply keeping an eye on it is often sufficient.
Makes sense. If it's harmless and not bothering you, why intervene? But what if it is causing symptoms? What might be tried first?
For symptomatic lipomas, the guide mentions some conservative things, although it does say they might not always work that well. Things like applying heat maybe helps if there's swelling adding to the pain, and massage, specifically acupressure techniques.
Okay. And then we get into more direct stuff, like injections. What kinds of things can be injected right into a lipoma?
The guide lists a few. Nodule injections often combine a local anesthetic, like lidocaine, with a steroid, like cortisone. The aim is usually to reduce inflammation and pain.
Right.
Then there are lipolysis injections using something called phosphatidylcholine. The idea is that this substance helps break down the fat cells within the lipoma.
Dissolving the fat, essentially.
That's the goal. And collagenase injections are also mentioned using enzymes that...
Yeah.
Also, cryolipolysis, freezing the fat cells like some cosmetic fat reduction techniques. Radiofrequency, RF, which uses energy to heat and destroy fat cells. And high-intensity focused ultrasound, or HIFU.
Do these work well?
How well they work can vary a lot, and they might be better suited for smaller, softer lipomas. It's less certain than surgical removal.
Right. Which brings us to surgery. Still the most direct way, I suppose. The guide details a few surgical methods.
Yes, surgical excision is common and often very effective. Liposuction is one option, especially for softer ones.
How does that work for a lipoma?
Small incision, local anesthetic, sometimes with what's called wet or tumescent technique, injecting fluid to numb the area and reduce bleeding. Then a vacuum sucks out the fatty tissue. The guide also mentions power-assisted and ultrasound-assisted variations to help break up the fat.
Okay. And the traditional way?
Traditional surgical removal, sometimes just called knife excision.
Yeah.
Clean the area, local anesthetic, make an incision big enough to get the whole lipoma out, carefully dissect it away from surrounding tissue, and then close up with stitches or maybe surgical glue.
And the guide also talks about cauterization, using heat.
That's right. Cauterization uses thermal energy to essentially burn away, melt, or vaporize the lipoma tissue.
What kinds of heat?
Several methods are listed. Electrosurgery uses high-frequency electrical current. Harmonic scalpels vibrate super fast to cut and seal tissue. Infrared CO2 lasers, even microwave tech, sometimes used with liposuction to help loosen fat and sterilize.
Lots of options there. It's interesting, though, that the guide says radiation and chemotherapy aren't generally helpful for lipomas.
That's correct, because lipomas are typically benign, localized growths. Systemic treatments like chemo, which target rapidly dividing cells all over, aren't usually effective or appropriate.
And radiation.
Radiation might be considered in very specific, rare situations, maybe for complex or recurrent cases, but the guide suggests that for typical lipomas, the risks of radiation usually outweigh any potential benefits.
Okay. So, even with all these treatments, things can still potentially go wrong, can't they? The guide outlines some potential complications.
Yes, like any medical procedure, there are risks. The guide mentions that if a lipoma is infiltrative, meaning it grows into surrounding tissues like muscle or nerve sheaths, it could be harder to remove completely.
Which could lead to recurrence.
Exactly. Regrowth or recurrence of RAPS is a possibility if any of the original lipoma tissue gets left behind. Also, larger lipomas mean larger incisions, more stitches, which might increase risks of scarring or local healing issues.
And risks from the treatments themselves, like the injections.
Potential toxic effects from injected chemicals are mentioned as a theoretical risk. And interestingly, the guide notes potential liver complications after surgery, which sounds a bit unexpected but might relate to anesthetic metabolism or other systemic effects in rare cases.
Huh. What about more common local issues?
Yeah, the more common local complications right at the removal site include infection, bleeding, bruising, hematoma, that's a collection of blood under the skin,
Oh, right.
seroma, which is a collection of clear fluid, scarring, and sometimes persistent pain even after removal.
Finally, under other reported treatments, the guide mentions turmeric. That's interesting. Is there anything to that?
The guide does mention anecdotal reports, people saying that turmeric, or specifically curcumin in turmeric, might slow down lipoma growth when eaten in food.
But just anecdotal.
Yes. It's really important to stress that the guide presents this as anecdotal evidence. It's not listed as a standard medically proven treatment. Much more research would be needed to see if it's actually effective and safe for this purpose. It's more of an observation than a recommendation.
Got it. So to kind of wrap up our deep dive into lipomas based on this really thorough guide you sent over, these fatty masses are surprisingly diverse.
Definitely more diverse than most people think.
And while we often don't know the exact cause, they can have a range of effects depending on their specific type and, crucially, where they decide to grow.
Right. Location is key.
Doctors have various ways to figure out what they are, from a simple physical exam to advanced imaging like MRI and CT using things like the Hounsfield scale.
Yep, the diagnostic tools are quite sophisticated.
And treatment options really run the gamut, from just keeping an eye on them to injections, non-invasive techniques, and different kinds of surgical removal.
A whole spectrum of approaches depending on the situation. And while they're usually not a cause for serious worry, it's important to remember they can sometimes cause problems due to size or location.
Right.
And in rare cases, they might be mistaken for or even potentially develop into something more serious like liposarcoma.
Yeah.
So getting them checked out is always the right call.
This has been incredibly insightful. Given the sheer variety we talked about and how much is still unknown about why they form, it really makes you wonder, what other unexpected places in the body might these fatty deposits pop up? And what could the consequences be in those less common spots? Maybe future research looking into those mesenchymal stem cells, where the fat cells come from, will eventually unlock more about why and how these growths actually develop in the first place.
That's a really fascinating thought to end on. A deeper understanding of the basic biology, the fundamental mechanisms behind these common but surprisingly varied growths could absolutely lead to even better ways to diagnose and manage them down the line.
Well, thanks for taking this deep dive with us today. We hope this exploration of lipomas has been informative and maybe answered some of your questions about these common yet surprisingly complex growths.